Hello everyone, my name is Moses Okosun. Today I'll be talking about the model of head promotion. In this slide, I'll be talking about a summary of current model of head promotions. Head promotion model are used for provisions of frameworks that make it possible for the understanding and influencing head behaviors. These include the trans-theoretical model. This is a past stage of change where behavior changes are described as a process through stages. The stages are pre-contemplation, contemplation, preparation, action, maintenance, and relapses. The second one is the ecological model. The ecological model is where many levels of influence on health are recognized. Some examples are individual, interpersonal, community, societal influence. The third one is the head belief model. This focuses on individual perceptions and modifying factors that influence health-related behaviors. And the fourth one is the theory of planned behavior. This suggests that intention shaped by attitude, subjective norms, and perceived behaviors control predict behaviors. And the fifth one is social cognitive theory. This theory lays emphasis on the interactions that exist between personal factor, behavior, and the environment. In this slide, I'll be talking about a comparison of at least two models used in health promotion, which are the health belief model, trans-theoretical model. The health belief model comprises of four different parts, which are strength. The strength of this model is that it is simple and particularly for short-term intervention. And the second comparison is focus. The focus here is on how people see, treat, and benefit. And the fourth comparison under health belief model is application. It is for use for one-time behaviors like in vaccination. And the fourth comparison under health belief is key components. This is for health belief model. The key components are perceived susceptibilities, severities, benefits, and barriers. And the fifth one is limitation. This ignores social and environmental influence. Under trans-theoretical model, the comparisons is strength. Under strength, here is that it is recognized relapse and gradual process. Focus on stages of behavior change over time. Application used for long-term behavior long-term behavior change, e.g., quite of alcoholism. And the fourth comparisons under trans-theoretical model is key components. Here we have pre-contemplation, contemplations, actions, and maintenance as key components. And lastly, we have limitation. Under these models, stages may not be linear and therefore hard to measure progress. In this slide, I'll talk about an evolution of the effectiveness of the two models in promoting good health. We'll talk about health belief model, the effectiveness of health belief model. This is useful for predicting. This is useful for predicting preventive behavior, but less effective for sustained lifestyle changes. The limitation under this is it overlooks social determinations and habit formations. And the evolutions of the effectiveness of trans-theoretical model is it is effective for prolonged behavior change, as seen in smoking, cessations, and exercise by addressing the readiness to change. The limitation under this is this model is criticized for making the stage long, so simple, and it lacks in consistent intervention sources. In this slide, I'll be talking about health promotion initiative. The health promotion initiative of choice is Healthy Live, Healthy Communities. It aims at improving public health, promoting healthier lifestyle choice, preventing chronic disease, and reducing health differences. On this slide, I will talk about the aim and objective of the initiative. Number one, to encourage healthier eating habits by encouraging increases in consumption of fruit, vegetables, whole grains, reductions in the intake of processed food, sugar, and excessive salt. Partners with school, workplace, and local market to promote nutritious food options. The second aim is promoting physical activities by making public space for exercise safe and accessible, e.g. park, walk tracks, and bike lane. Through recognizing community fitness programs like yoga classes, walk club, and sports leagues, and reductions in sedentary behavior in workplace and school with good schedule intervention period. The third aim is prevent chronic diseases. Awareness creations about risk factors for chronic diseases. Provisions of free or low-cost health screening. Support of smoking cessations and alcohol moderation program. The fourth aim is improve mental well-being by reducing of stigma around mental health issues, promotion of stress management techniques, strengthening of community support network. And lastly, enhance health literacy through educations of public on recognizing symptoms of common illness, improvements of understanding of preventive health care, use of digital platform to disseminate reliable health information. And in this slide, I'll talk about the effectiveness evolutions. To assess the sources of this initiative, we use both quantitative and qualitative measure. Number one is short-term sources, which is about 6 to 12 months. What is assessed here is behavioral change, screening uptake, and awareness. Number two is medium-term impact, which is about 1 to 3 years. The assessment is the reductions in risk factors to ascertain decline in smoke rates and sugary drink consumption. Local government adoptions of healthier school meal, program and urban planning for workable communities, and more grassroots health advocate group formed. The number three is long-term outcome, which is about 5 years plus. The assessment outcome will focus on getting lower chronic diseases rates, healthier generation, improved child health due to early education on nutrition and exercise, and economic benefits through decreasing health costs. And on this slide, I will talk about choosing agency is WHO. Evolution of its contributions to public health. The WHO, which is World Health Organization, is a leading global agency responsible for the directing of initiation, health initiative, setting norms, and coordinating responsible to health emergency. While it plays a crucial role in shaping health system and coordinating responses to health emergencies, its effectiveness can be measured through its strength and limitation. In this slide, I will talk about the strength of World Health Organization. Number one, disease preventions and control, which is eradications of chickenpox in 1980. WHO contributed to the eradications of smallpox in 1980 is a historic accomplishment that shows its strength in coordinating global health response. Polio elimination efforts. The global reductions of polio cases by 99% through vaccinations campaigns shows WHO success in massive vaccination campaigns. Thirdly, secondly, emergency response and pandemic management. COVID-19 response. During the COVID-19 pandemic, WHO coordinate global research, distribute vaccines through COVAX establishments, public health guidelines for the disease. And the third strength of the WHO is health policy and advocates. Framework Conventions on Tobacco Control. Its framework, Convention on Tobacco Control, which is also known as FCTC, contributions to reductions of global smoking rates through taxations and advertising bans. Universal health coverage, which is also known as UHC promotions, WHO push for universal health coverage, promotes equitable healthcare access globally. And the fourth strength is health education and awareness. Global vaccination campaign. Through global vaccination campaign, WHO has created an increase in awareness and an increase in immunization rates for diseases like measles, HPV, and other preventable disease. On this slide, let's talk about limitations of WHO. Number one limitations in the WHO is equity problem. Despite programs like COVAX, distributions of vaccine remain unequal. Low-income countries often receive vaccine much later than high-income countries. And the second limitations of the WHO is funding constraint. World Health Organization relied heavily on voluntary contribution from member states and private donors. This sometimes limits its ability to respond quickly to emergency without government influence. The third limitation is lack of enforcement power. WHO cannot enforce its recommendation, making complaint by country's opinion. Sources depend on each country's readiness to implement recommendations. Fourthly, the fourth limitations of the World Health Organization is criticism over handling of pandemic.